Welcome back to another video. My name is Sean and I'm a registered dietitian. Today I'd like to share with you a little bit about what my day looks like. This is a question I get asked often by interns and one that you might have if you're interested in getting into the dietetics profession. Now, generally speaking, as a dietitian, there's a lot you can actually do with the field. You can get into outpatient, such as dialysis, or outpatient education, whether it's heart healthy, diabetes, or private practice outpatient education. There's also skilled nursing facilities, there's sports nutrition, and then there's a sector called clinical nutrition, and that's what I do. I work in a hospital and I practice inpatient clinical nutrition medicine, if you would call it. And so most dietitians that do inpatient nutrition therapy will start their day off somewhere between 7 and 8:30 p.m. and they'll come in and their job is to make a list of all the patients they have to see during the day. So the first thing you're going to do is you're going to make a list. Now that list could be for the entire hospital if you're the only dietitian or one of the only dietitians there, such as this hospital, or it could be for the units. Now, there's a lot of different units that a hospital might have. Units. Marker's not writing too well, I apologize. There's cardiovascular, there's neuro, there's ICU, there's surgical, there's medicine, medical, sometimes there's oncology. So there's a lot of different areas that people can specialize in during their day at the hospital. You might be assigned a desk that contains one or many of these categories, or you could be floated around. So if there's a dietitian that calls out, you might float around to different units. And that's what I did for my first several years as a dietitian. And a technique that I actually recommend for a lot of new dietitians is don't get stuck in doing the same kinds of patients every day. Float to a lot of different units and make yourself very valuable across the different specialties that you might see at the hospital. So your first job is to make a list. And this list is going to be which patients do you need to see that day. And this list could be consults. Apologize, this marker's really bad. I'm gonna have to get a new one tonight. It could be new consults, doctor ordered consults. Hey, we need you to see this patient. It could be based on BMI. So we can print off a list that has the BMI, the body mass index. That looks at a ratio of your height to weight. And if your BMI could be under 20 for some hospitals, it could be under 19. Typically, if we see a BMI of 21 or less, that usually indicates a patient is either normally at a good weight or they've been losing a lot of weight. There's most hospital patients, the average BMI across the hospital is somewhere between 27 to 28, which is in the overweight category. So if you've got a BMI under 21, even if it's considered a normal BMI, you probably have lost weight. Not a lot of people have BMIs under 21, and certainly a lot of people with BMIs under 19 have been losing weight. They could be chronically or acutely malnourished. What else might we use to determine? It could be anyone on sedation medication, such as propofol. It could be, you might screen every patient in your unit, such as if you have ICU, you might screen every patient and look for someone who maybe was started on nutrition support. Another thing we look at is warfarin, new warfarin. Warfarin or Coumadin is a medication, it's a blood thinner, and so they have to follow a consistent vitamin K diet, and so we might do education with our new warfarin patients. We might look at patients that have been NPO. They haven't been fed for the past 3 days or 5 days, whatever your policy procedure is, your facility procedure is. If they've been NPO clear liquids for more than 3 or 5 days, you might go see them. And then last but not least, length of stay. So if the patient's been at the hospital for 7 days or 10 days, you might go see that patient as well. So we'll make a list of all the patients that we have to see. And then at that point, we can go up to the units and we can go see those patients. Now, sometimes you might have a dietitian huddle in the morning down in your office. Maybe it's in the afternoon. Maybe you don't even have a huddle at all. When you go to the units, you might have rounds. So we have ICU rounds every single day where the interdisciplinary team, RT, OT, speech, dietary, could be the nurse, the unit nurse, the charge nurse. It could be the pulmonologist, the intensivist for the ICU, the doctor for the ICU. You'll round on all the patients and talk about how they're doing. Are they eating well? Are they drinking their supplements? Are they on nutrition support? Do you need to be consulted to see them for nutrition support? The other thing that I did forget to mention here, which is important, is your follow-ups. Patients that you might have seen last week, patients that you might have seen a few days ago that need to get seen again. Are they drinking their supplements? Do they understand that nutrition education that you did for them? Do they need to have adjustments to their nutrition support? So follow-ups is going to be another big one too. And that's what you'll take care of. Now, depending on how many patients your list has, you might not get to everybody. Now, ideally, all hospitals would have enough dietitians to see every patient that needs to get seen in the hospital, but that's not always the case. So you might arrange your list in a way that you'll see the higher risk patients. So your new consults, your nutrition support, your TPN, your tube feeders, maybe your diet educations for your folks that will be discharging, such as new diabetics maybe that are leaving, or your new warfarins that are leaving. Your propofol might indicate new tube feeders. And then you could see maybe your length of stays, and then maybe do your NPO clear liquids, and then maybe do your follow-ups. Follow-ups, you've already been following them. They probably already have an intervention in place, and so you try and get to them, but if they have to get pushed back a day, sometimes that happens. Also, some of your malnourished, your BMIs, if there's a really low BMI, an 18, a 17, a 16, a 15, a 14, depending on how bad their BMIs are, you might put them in line with some of these length of stays or NPOs. I might see them after my consults and my tube feedings and my TPNs. I might go see the low BMIs and then do the length of stay, the NPOs, and then the follow-ups, something like that. Your hospital might also have protocols such as ERAS and an enhanced recovery after surgery protocol, typically reserved for your GI patients. So that GI protocol might kick off these consults for you. So every time a patient goes in for GI surgery, it might automatically generate a consult. So you might have a protocol in here that's generating consults for you to go see as well. And then you'll have lunch, typically as a team. Usually dietitians like to eat together in a group, and so it's important to do that to get to know your coworkers, to work better together. And then after lunch, you can also touch base with your coworkers. If you get done your patients early, you can offer help. Hey, Joan, do you need me to see some of your patients? Or should I start seeing my follow-ups for tomorrow or some of my lower risk patients? So you can touch base as a team, see how everyone's doing, and if you can pick up any of the extra slack, that's always appreciated. And then throughout the day, as you're seeing patients, you'll chart on them. So you'll open up the electronic health record and you'll chart on your patient, talking about what interventions you've did for them, some subjective information from the visit, what that patient might need, some education that you did for them. And then depending on the type of electronic health record, you might be able to put in when you're doing your follow-up date. So you could put in 3 days from now, 5 days from now, 7 days from now, if your electronic health record allows you to put in follow-up dates. Then you could maybe clean up your desk if you have any online educations or trainings required by the facility. I know here at this hospital and most hospitals, you'll have annual trainings for HIPAA training. There's a lot of different kinds of training you might have on the computer that you might have to do monthly and annually. So that might be something else you could toss in there. Clean up your desk and then go home. Then the next day you get to repeat it all over again. Now that might seem redundant, but the nice thing is if you float to different units, not every patient's the same. One patient might be a new diabetic. One patient might be a new end-stage renal disease. Another person might be nutrition support. Another person might be someone's grandma who just needs help eating a little better, might need an OT eval. So there's a lot of different stuff that you can do during the day to keep it interesting. So especially the smaller the hospital, the more variety you'll get. The bigger the hospital, typically you'll be assigned to a desk that is usually 1, 2, or 3 units. So it could get redundant in that regard. But it definitely keeps you on your toes. It keeps you engaged. And the nice thing about being in clinical nutrition is you don't take the work home with you. You can't access the medical record from home. You can't chart and see patients from home. So as long as you wrap up nicely at the end of the day, it's really nice to come home and not bring that work and that stress with you. And then when you come to work the next day, you start off fresh with a whole new list, and you can go see your new patients. So I hope that gives you some insight in terms of what your day might look like, and certainly what my day looks like here at this hospital. If you have any other questions about nutrition, dietetics, clinical nutrition, post them in the comment section down below and I'll answer them or make a video on them. Again, if you have any other interest in nutrition support videos, I have a lot of those out there as well. And if you like this content, please give me the thumbs up and subscribe for more. Thanks guys for watching. Cheers.